Have you ever felt as if an invisible needle were piercing your neck and suddenly your arm started to burn or the muscle between your shoulder blades hurt as if you had been hit? That twinge that goes up the back of the neck and creeps into the shoulder, the arm, or the rhomboid area is more common than you imagine, and many times people confuse it with a simple muscle pull or with office fatigue. Today, we are going to unravel what is actually happening when a nerve gets trapped in the neck, why it causes that radiating pain, and most importantly, what you can do right now to relieve it without the need for a prescription. If you have ever spent nights tossing and turning in bed because the tingling won't let you rest, stay with me because in the next few minutes we are going to transform that discomfort into a feeling of control and relief. I am a certified physical therapist and I have been helping people suffering from this type of pain for more than 10 years. What we are going to explore is based on basic anatomy, tests you can do at home, and simple techniques that you can apply without specialized equipment. Understanding the anatomy. First, imagine your cervical spine as a tower of 7 blocks, each called a vertebra, and between each block there is a disc that acts as a shock absorber. The nerves that come out of the spinal cord, especially those corresponding to levels 5 and 6, travel between those blocks and head toward the brachial plexus, which is the network that controls the movement and sensitivity of the arm and shoulder. When one of those discs shifts a little, or when a small bony growth called an osteophyte forms due to age, or a hunched posture, the space through which the nerve passes narrows. That compression is what generates the typical tingling, the sharp pain that intensifies when moving the head or lifting the arm. Recognizing the symptoms. Now that you know where the problem is, let's recognize the symptoms that indicate you really have a pinched nerve and not just a muscle contracture. The pain usually worsens when turning the head toward the affected side, tilting it forward, or lifting something above the head. It is also very common to feel a sensation of numbness or pins and needles in the thumb, index, and middle finger. The rhomboid muscle, located between the shoulder blades, can become inflamed because it is overworking to compensate for the lack of shoulder movement. Give it a like if any of these signs sound familiar, because that helps us know this content is reaching those who need it. Home diagnosis tests. To confirm if it really is a pinched nerve, you can try some simple movements at home. 1, place your right hand on your forehead and slowly turn your head to the left as if you wanted to look at your opposite shoulder. Notice if the pain or tingling increases. 2, bring your chin toward your chest and hold the position for a few seconds, feeling the pressure in the back of the neck. 3, tilt your head back and turn slightly toward the opposite side. If in any of these tests the pain spikes, it is very likely the nerve is under compression. Remember, these are only indications and do not replace a professional evaluation. If the pain is very intense, if you notice loss of strength in the hand, or if the numbness persists for more than a week, it is time to seek a doctor or a specialized physical therapist. Immediate relief techniques. 1-point postural correction. Imagine a string gently pulling from the crown of your head toward the ceiling. That slight elevation of the head helps open the spaces between the vertebrae. While working on the computer, keep the screen at eye level and rest your forearms on a table, avoiding tilting your head forward. 2, self-massage. With your right hand, place your fingers on the side of the neck, just below the base of the skull, and apply gentle pressure while sliding your hand down, following the line of the scalene muscles. Repeat 3 or 4 times. Then, cross your arms over your chest and use your left hand to make small circles on the upper trapezius area. 3 Farah-specific exercises. Controlled neck rotation. Use a resistance band, hold it with your right hand, and place the band around your head with gentle tension. Turn your head slowly to the right against the resistance, hold, and return. Scapular retraction. Sit with your back straight, pull your shoulders back, and join your shoulder blades as if you wanted to hold a ball between them. Hold for 5 seconds and release. Prevention and long-term care. Beyond the movements we have reviewed, there are other routines that help prevent a relapse. Dynamic scalene stretch. Stand with feet shoulder-width apart. Slowly tilt your head to one side while keeping your gaze on the horizon and slightly lift the opposite shoulder. Arm elevation with external external rotation. Hold a light weight, lift your arms laterally until they are parallel to the ground, and slowly rotate your palms upward. Diaphragmatic breathing. Practice breathing into your abdomen rather than your chest. This favors muscle relaxation and decreases the sensitivity of the irritated nerve. Ergonomic adjustments. Adjust your desk height so your elbows form a 90-degree angle and keep your mobile phone at eye level. For sleep, look for a pillow that maintains the natural curve of the neck and consider a small rolled towel under the cervical area for extra support. When to seek professional help. Warning signs include loss of strength in the hand, difficulty lifting light objects, or numbness extending to the full hand. In these cases, a medical assessment is indispensable. A professional may request an MRI or X-ray to determine if more invasive treatment is necessary. Final tip, keep a record of your symptoms in a simple table. Note the time of day, pain intensity 110, and activities performed. This information is invaluable for your therapist. Also, stay hydrated. Intervertebral discs need water to maintain their cushioning capacity. Recovery from a pinched nerve requires time, patience, and regular practice. Dedicate at least 10 minutes a day to your routine. What will be the first habit you incorporate today to take care of your rhomboids? Leave it for me in the comments. I will love to read you. See you in the next video, and keep moving with awareness. Would you like me to help you create a bulleted summary of the exercises mentioned in this text for a quick reference guide?